Hey everyone, today we're going to be covering how to assess a potential meniscus injury from the comfort of your own home. I'm Dr. John Schaefer. I'm a physical therapist, board certified in orthopedics, and also a strength conditioning coach. I've helped hundreds of people overcome their knee pain and reclaim their lives, and I want to help you do the same. So, if knee pain's been getting in the way of your life lately, you're not alone. Meniscus tears are one of the most common injuries to the knee that we see, and it's something that'll oftentimes come up on imaging for healthy individuals as well as individuals with dealing with knee pain. There was a study that came out a couple years ago that showed meniscus tears to be present in over 60% of adults. Many of those people aren't even having symptoms. And most of the time, these tears aren't even from an injury, they're just part of normal wear and tear as we age. So let's get into this video here. We'll cover how to assess whether or not you might be having a meniscus injury, and we'll also get into some different treatments and approaches. So let's start with what the meniscus is and why it actually matters. So the meniscus acts as a cushion between the thigh bone here, the femur, and your shin bone, which is your tibia. And every knee has two menisci, and really their job is just to absorb shock and keep the knee stable. Now, there's two main types of meniscus tears. We have degenerative tears and then traumatic tears. So, degenerative tears are just tears that occur over time as we age. Not necessarily anything that you did wrong. You've just lived an active life. You put a lot of strain on that joint, and that can lead to changes and irritation to that tissue over time, potentially. And like I said earlier, sometimes this is painful, other times there's no issue whatsoever. And the second kind of tear is traumatic. So this is when you have a quick movement, you twist your knee wrong, anything like that that leads to a tear in the meniscus where you can point to a specific event and say, hey, this is when I injured my knee. That would be more of a traumatic meniscus tear. So let's get into something you can try at home to get a better idea of if your meniscus might be the issue. This is known as the meniscus cluster. It's a group of 5 different indicators that research shows can really help to pinpoint if you've got a meniscus tear or not. I'll walk you through each one and then we'll talk about, again, how you can do this at home. So if you have a foam roller, if you have a pillow, anything like that, I want you to grab it because first up, we're going to do the foam roller test. So for this test, you're going to place a foam roller underneath your foot and you're going to gently press down, pushing your knee into full extension and even a little bit beyond. And then I want you to think about if you're having any pain or discomfort, any tenderness with that movement, that can be a sign that the meniscus may be involved in your knee pain. Number two, for this test, you're going to set the foam roller aside and you're simply going to pull your knee towards your butt. And the last test was called forced extension. When you're extending the leg all the way, this test is called the forced flexion test. So again, pulling that leg as close to your butt as you can, really trying to get to that end range flexion, that end range bending of the knee. And if you have any sharp pain here, this can also mean that meniscus is irritated. So those first two tests are pretty simple. One, you're pushing into full extension. Others, you're trying to get into full flexion. And once we're done with that, we'll get into our third part of the cluster, which is just whether or not there's any popping or clicking. So if you're hearing or feeling a popping or clicking sensation, especially if it's painful, that can be another red flag for a meniscus injury. So think about, when you're walking upstairs, walking downstairs, maybe you're just walking throughout your day. If it's not painful and it's not causing you too big of an inconvenience, probably not a big concern. A lot of people ask me day to day, this or that joint's popping, clicking, is that normal? Well, if it's not producing any kind of sharp pain, then it's not necessarily something to be overly concerned about. Number four, have you noticed any buckling? So that's when your knee gives out, your knee's feeling unstable. If you're experiencing any of that, it's time to start taking this injury a little bit more seriously. Because what we don't want to happen is you to be, out in the community, walking around, exercising, things like that. And then all of a sudden your knee gives out and you're falling or things like that. So buckling is number four, or the knees giving way essentially. The last test, this is the test for joint line tenderness. So if you press along the side of the knee joint. See if it's tender. This could potentially point to a tear, and this is often used by physical therapists or doctors as a quick screen. So here's my knee model here. You're just palpating or touching along the side, this inside, and then, or sorry, this is the outside, and then palpating on the inside as well. And just kind of feeling around for any sort of tenderness. The reason this cluster is so helpful, if you have 3 out of those 5 tests come back as positive, then you have a 90% chance that the meniscus is involved. If there's 4 out of 5 positives for those tests, you have a 96% chance. And then if all those are present, there's a 99% chance the meniscus is involved. So think about that in terms of, those are all things you can do at home. All those things can help you point to figuring out if the meniscus is involved, and they're all pretty easy too. But just remember, these are indicators. They don't replace any kind of professional diagnosis. But if you are feeling pain with 2 or more of these tests, it might be time to check in with a healthcare provider, get a second opinion. So then the question then is, if you do have a meniscus tear, what's next? Well, for most degenerative tears, that's the wear and tear kind. Physical therapy and strengthening exercises are really the first line of defense. Research is now showing that conservative management, such as physical therapy, can be just as effective as surgery for so many people. And it's important to note too, if you do have surgery, you're going to need physical therapy afterwards. So the best case scenario is you're trying physical therapy beforehand, get as strong as you can, and then if all else fails, go to surgery. Now, where the cases are more traumatic, and especially in younger individuals or people who are pretty active, surgery might still be recommended. But again, that's going to be a decision between you and your healthcare provider based on your specific symptoms and really the goals that you have. So, I always recommend some simple exercises to help manage pain and keep the knee moving. So, during the time when you do following a meniscus injury or meniscus irritation, it's super, super important that you're keeping the knee moving within comfortable ranges, and you're also working on strengthening the muscles around the knee so that you can maintain stability. We talked a little bit about at the beginning how important that stability is, and the job that the meniscus does in providing stability. So if the meniscus is irritated, that's where you start to lose some of that stability. But a good way to make up for it is quad strengthening. I've got so many quad strengthening exercises on my page, so feel free to look around there. But really keeping that knee moving as well as we can, strengthening the muscles around will give you a really good start. And if you do need additional guidance, feel free to send me a message or comment on this video, and I'm happy to see if I can help. So really, to sum it all up, meniscus tears are extremely common, especially as we get older. So if you're noticing knee pain, instability, clicking, the meniscus cluster tests might give you some different insights, but again, always consult with a healthcare provider for a clear diagnosis and a clear treatment plan, because it's helpful to have an idea about some of these principles, an idea of what's going on. But again, if you're not seeing that progress, then we need to take an additional step. So don't forget to like, subscribe, drop any questions or experiences that you're having in the comments. I'd love to hear from you. And remember, taking an active approach is always going to be the best following injury, following recovery. So don't wait. Don't hope that this thing's going to get better on its own. Be informed about what's going on and then come up with a plan of how we can address this. Thanks for watching, and we'll see you in the next one.